River.
Thank you, Mr. Speaker. On Friday, Canada's Chief Medical Officer released an update on COVID-19 modelling in Canada. Well, the numbers were sobering and a stark reminder of the serious situation we are in. One thing really stuck out to me. There was no real mention of Indigenous people nor their communities in this report. Mr. Speaker, how can this government properly support Indigenous people at this time when they're not even included in these significant reports?
The Honourable Minister.
Well, Mr. Speaker, as the member well knows, the last week for Indigenous peoples has seen a multiple rise in cases affecting Indigenous communities, and indeed it is alarming. What the member has also seen is targeted responses in Manitoba, Saskatchewan, and Alberta, and the Government of Canada stands with those peoples as they deploy exceptional measures to defend their people and to prevent their communities from contracting COVID, and we will always be there with them. Thank you.
The Honourable Member for Desnate, Mississippi, Churchill River.
Mr. Speaker, my question was about data. With the alarming rise of cases in Indigenous communities, the Minister of Indigenous Services this weekend spoke about the lack of accurate data. On April 28th at the INAN Committee, I asked the Minister directly what actions his department was taking to ensure informed decisions. 7 months later, a second wave is overwhelming Indigenous people and their communities, yet we have more news stories about how a lack of data is still a problem. Mr. Speaker, does the Minister have a solution, or is it simply too late?
The Honourable Minister of Indigenous Services.
Well, the collection of data, Mr. Speaker, is an ongoing process. What we do know is what we are able to, as a matter of effective jurisdiction control, which is the situation on reserve. And we know that that data so far has been positive. The alarming rate of increase over the last few weeks is indeed alarming. And that's why we are deploying tailored resources based on the feedback that we've gotten from communities. Where we see that vulnerability, Mr. Speaker, is frankly in urban settings. And that requires partnership with Indigenous communities on the ground as well as the provinces. And that is what we will constantly be striving for. That continued work so that we can have a tailored health response to a world pandemic. Thank you.
The Honourable Member for Desnate, Mississippi, Churchill River.
Mr. Speaker, pointing the finger at the provinces is not going to solve the problem. Let's try something different. On December 20th of last year, Maxwell Johnson and his granddaughter were handcuffed and put in the back of a police cruiser for simply attempting to open a bank account using a status card as identification. Today we learned that it was ISC, the minister's own department, that encouraged the bank to call 911. Mr. Speaker, does the minister actually think that this was an appropriate response by his department?
Honourable Minister.
Well, Mr. Speaker, the incidents in question are exceedingly alarming. Indeed, they did occur a year ago, and what we saw is a process of systemic racism showing its head on the ground with the results that it had with the police intervening. Clearly, all members of society need to know and respect the validity of a status card. I only recently got the transcript of the 911 call and in the process of reviewing it. It is slightly unclear, but if there is an Indigenous issue, if there's an issue with Indigenous Services Canada and its involvement, we will act swiftly. Thank you.